My name is Dr. Maggie Bland, and I'm a faculty member in the program in Physical Therapy and Department of Neurology at Washington University School of Medicine. Physical therapy is the rehabilitation of people, and it can be people who have had a recent medical event, so somebody who's had a spinal cord injury, brain injury, and we can work with people to get them to walk again. It can be people who've had low back pain, a knee replacement, any type of orthopedic injury, helping with that, both the arms and legs and trunk. We also work with kids, so pediatrics, as well as older adults. And then aspects of physical therapy can work with people in general on weight loss and management of just kind of chronic conditions or good health. I became a physical therapist because I wanted to help people and help people to live their lives, either go back to the way that they were living before their injury or to improve their current state. And I really fell in love with helping people. I specialize in patients with neurological deficits, so stroke or spinal cord injury or brain injury, and I love helping people recover, so get back to walking or being able to go home and function in that environment and function in the community. Right now, physical therapy has transitioned to a doctoral level degree. And so you have to complete 4 years of undergrad and then complete a doctoral level degree at an accredited college. So it would be an additional 3 years on top of that. In addition to that, I'm a neurological clinical specialist. So I have studied and sat for an additional exam on top of my regular licensure exam. We can work in a variety of settings. So myself, I work in an academic institution. I do research and instruction to physical therapy students. You can work in a hospital or a rehabilitation center, a skilled nursing facility. Physical therapists work in outpatient clinics where you might you live at home, but you go for therapy. Physical therapists work out in the community, so in school districts, they're in schools working with kids. They work in summer camps. There's physical therapists who treat patients in the pool. So kind of all over, all different venues. I love just making a difference in people's lives. I think nowadays emergency medicine is so good that people are living through things that we normally wouldn't live through, and as a result we're living longer, but the quality of our life might not be the same, and it changes when we have different illnesses or sicknesses. And so I love hopefully being able to help people get back to doing things. It might be slightly different, but get back to doing things that are meaningful to them and able to return home and live with family and loved ones, and then to get out in the community and know that they can go see a movie or go shopping and return to driving. So that's what I love about it. When I went to undergrad, I decided I really like science, so I majored in biology. And then as a junior, senior, I started thinking about the next steps, what I wanted to do. I thought about medical school, took all the preliminary tests, and then I thought about PT as well, took all those tests, and I decided, I really like the field of rehabilitation and working with people, getting back to where they started, and I value exercise and fitness and all of those things, so I decided to go that route. Find something that you love and you're passionate about. It's going to be hopefully your career for the next 30 or 40 years of your life. So if you can't go to work every day and love at least one part of what you do, it's going to be really tough. So make sure whatever you decide to do, whether it's physical therapy, whether it's being a physician, something in the medical field or not, that there's aspects of your job that you really like, because it won't be easy. But it's definitely rewarding if you're going to work and doing something you enjoy.